Hi, this is Dr. Amie Harwick, and I'm here today with Pineapple Support. I'm a licensed marriage and family therapist. I have a private practice in West Hollywood, and today I'm going to be talking to you about anxiety. We're going to be going over what anxiety is, how it presents differently, how this may affect sex workers or people that work in the adult industry, and then lastly, what you can do about it. So anxiety is a normal and natural part of being alive. Pretty much everybody has some level of anxiety. So if you have anxiety, number one, you're normal and you're human, you're alive. And that is something we should be thankful for, because our anxiety is a natural function that our brains and bodies have in place that engage us in a fight, flight, or freeze mechanism. So typically our anxiety is there as a protection, as a means of survival. And so it's when this mechanism gets out of whack that we typically feel extremely uncomfortable or when we get dysregulated. So typically when we're anxious, we're in a situation that creates some type of distress for us that may cause us to shut down, may cause us to want to run or want to fight, whether that's physical or emotional. When our anxiety doesn't work for us anymore, that's when there ends up being a level of distress or problem in which we seem to have problems in our relationship, in our work, or we might seek out therapy or some other types of support. So in regards to the diagnosis of anxiety, diagnosis as a therapist, I will tell you, is really here for us to be able to take a cluster of symptoms that typically occur together and be able to give it a name or a label, and so that we can create treatment plans for it. Another reason that there are these diagnoses are for insurance companies to be able to have a reason to pay out the therapist or the professional so that they can then provide services. But psychological, unlike medical diagnoses, they're a little bit different. So we typically see these things changing throughout cultures, throughout time. So when somebody's labeled as having anxiety or an anxiety disorder, this isn't always black and white. So we have to be really careful of how we stigmatize different types of anxiety when people have them. Again, just a reminder, anxiety is a normal, natural, and healthy part of being alive, but sometimes that anxiety doesn't serve us anymore and it causes us to feel dysregulated or in distress. So there are many types of anxiety. Now, as I mentioned, there's normal, natural, healthy anxiety that's just a part of life that's function is to help keep us alive and keep us surviving. Sometimes that feels a little more problematic, and that's when certain types of anxiety become problems for us. So the first one that I want to talk about is generalized anxiety disorder. So that's typically when for about 6 months or more, you're worried about most things most of the time. You might have symptoms such as increased heart rate, sweating, stomach aches, headaches. You might feel like there's an impending sense of doom or danger. And these symptoms typically are a generalized anxiety disorder. So I would definitely suggest, if you're feeling these types of things, to seek some help. Obviously through Pineapple Support, they're great. They're going to connect you to some wonderful resources, but a therapist, a group, or other types of things that we're going to talk about in this video shortly to engage in to help re-regulate your body. There's also social anxiety. So if you feel like when you're in a group of people, you feel highly anxious, those same body dysregulation feelings such as heart palpitations, sweating, headaches, stomach aches, feeling of doom, nervousness. That could be related to more social environment, which obviously if you're working as a performer could be something really challenging for your career. So there's social anxiety. Also there's panic disorder. Now, a lot of times people confuse high anxiety moments for panic attacks. So when somebody's feeling a very high anxiety moment and dysregulated because of severe anxiety, typically it's a slow escalation, it takes longer, and it's about a specific thing that you really know. For example, if you're having a very severe argument with your partner and it's about a topic that causes you a lot of stress or anxiety, you may feel like slowly you're getting more and more dysregulated and still might have high heart rate, deregulation, depersonalization, all of these things that could happen to really make you feel out of control. But that's more of a high anxiety moment, whereas a panic attack typically feels like it comes out of nowhere, which is why people who get panic attacks might go to the hospital thinking that they've had a heart attack, and they're sent home with a packet about panic attacks. So panic attacks typically are from trauma or high anxiety, but typically hit you from out of nowhere, last for less than 10 minutes, are very intense, but oftentimes resolve very quickly. So a panic attack disorder is when you've usually had one panic attack and then you're really scared that they're going to happen again. So you avoid all of the triggers or stimulations that might make you think you're going to have another panic attack. So typically, panic attack disorder is about avoidance. And then there's also obsessive compulsive disorder and PTSD. Now, a little bit about PTSD because it's something that people are luckily now talking about a whole lot more in the past 20 or 30 years. There's some really wonderful books on trauma. I would highly recommend The Body Keeps the Score and also Waking the Tiger. Those are some good ones to check out. So typically PTSD occurs when you've had an exposure directly or indirectly to something that is life-threatening or seemingly life-threatening. It could also be that you're a first responder or you are hearing about somebody else's trauma. Now, of course, we think about those first responders on the scene at 9/11. We're thinking about therapists or doctors, but also oftentimes we don't talk about how much sex workers are listening to other people's trauma, whether it's on set as a performer, we're talking about dancers, we're talking about people that do sex work or escorting when they're one-on-one with somebody that wants to talk and connect. Oftentimes, sex workers are the recipients of other people's traumatic information. So if you are in a situation where you are receiving somebody else's traumatic information, that can take a really big toll on you. And if you are not caring for yourself through self-care, therapy, and other resources, that can affect your functioning and cause anxiety or even PTSD. Those are some of the general types of anxiety we might see, but that's when it becomes so problematic it could be coined or labeled as a disorder. And even if it's not meeting those criteria, it still can be very disruptive to your life professionally and personally. So we're here through Pineapple Support. So let's talk for a moment about how this can impact or how anxiety can impact somebody who is a sex worker or specifically an on-camera performer. So when I say sex worker or on-camera performer, I'm not just talking about the people who are traditionally in front of a camera on a set. We're talking about adult performers on set that are contract performers. We're talking about freelance webcam or cam performers. I'm also including a larger umbrella of people that define themselves as sex workers that may or may not call themselves performers, and that could be people that do sugar baby behaviors or escorts, exotic dancers. The umbrella for sex work is actually so large, and there's no hierarchy or somebody that might experience something more or less. And most of that reason that I'm saying that is there's not a lot of research on who's experiencing what. So let's just throw a big net out there and say people that do sex work are typically underrepresented, often stigmatized, and typically there's not a lot of research or support for this population of people. So here are some things that when I, as a therapist with my background, was considering the work I've done with sex workers, and also just the things that I think that could come up. Here's some ideas that I have. And of course, if there's anything additional that you can think of that you'd like to share with me, you can find me through Pineapple Support or through my social medias or my website. So because of the nature of the business, you don't get a disclaimer. You don't get a handbook that says, welcome to being a sex worker. Here's how anxiety might affect you, or here's what might cause anxiety with the work that you're currently doing. This isn't a traditional career path where you get a lot of support unless you go out and seek it, which until recently might have been a little tougher than it is today, but it's still not very easy. So there's a lot of things that could come up. Many sex workers, as I already mentioned, take on a caregiving role. So you're in this caregiving role with people, whether it's physically, emotionally, sexually, or all of the above, and there's not a lot of resources on how to manage what you're hearing, what you're feeling, and what you're experiencing. And that's with what other people are putting on you, physically, emotionally, sexually, or how you're processing, engaging with these new people, new partners. So you're in a caregiving role, and I think that that's not something that's often stated. And as a caregiver or as somebody receiving other people's information and feelings, you have to take care of yourself a little bit more. There's generally, as I mentioned, a lack of support. So Pineapple Support is a really great resource to connect to therapists, and they can also connect you to other resources as well. When you find sex-positive therapists, you might want to ask them about groups or other types of resources they can connect you to continue to get additional support. Another thing that might cause anxiety or might add to anxiety is the challenge of sex work, the legalities, and the stigma. So of course, we know that there is a stigma, and we're working, a lot of us in the sex-positive community, to help to reduce that stigma over time, but it's going to take some time. In addition to that, there's also legal issues. The laws are constantly changing. It's difficult to keep up with, and if you've had a legal issue, as a sex worker, that makes it that much more anxiety provoking to continue working in fear of more legal issues and people in the legal system not understanding or empathizing what you do. So there's multiple layers of things to be anxious about, or things to be fearful about, that will interact with how you engage in the world around you. In addition to all of those things, you're also typically self-employed. Being a person that's self-employed, that doesn't have a benefits package and doesn't have paid time off, brings its own level of anxiety. So aside from all of the stigmatized difficulties of just being a sex worker, you also have all of the things that come with being a freelance person. That's a creative, self-employed person. There's so many benefits there, but it also brings a lot of aspects of anxiety about income, how work is regular, or how there can be gaps in time with work. How your career path is going and decision making with your career path, because there's so many options as a sex worker. So there's legitimate things here that are really not talked about, that are very valid things to cause a normal amount of anxiety. So that being said, yes, there's legitimate, valid anxiety as a sex worker and as a human being. And what do we do with those things? Well, I'm going to tell you. Now that we've talked about anxiety, let's talk about what you can do about it. The great thing with anxiety is that there are so many tools and there are so many things that are within your control. In fact, one of the greatest quotes I heard from a colleague of mine is, when we think about anxiety, we need to remember that it's an inside job. So anxiety is something that's happening within you, and it is not the environment around you. It is up to you to decide how you want to perceive and engage in the environment around you, and look at the stimulus or stimuli of what's causing your anxiety. So the first thing that I want to emphasize, which is really simple and within your control, is number one, self-care. So self-care is a word that gets thrown around all the time. So let's break down what self-care actually means. So the first thing that I want to emphasize when we're talking about self-care is just the basic first tier of the hierarchy of your needs. So are you sleeping adequately? Getting 7 to 9 hours of sleep as an adult is very important, will affect your mood, your functioning, and your health. Number two, how you're eating. Are you eating regularly, healthy, smaller portions, getting nutrition? If not, you can consult a nutritionist. You can do some research on nutrition. Even if funds are low, there's always ways to access healthier food. Hydration. Are you drinking water? Sounds so simple. If you're feeling anxious, drink a glass of water, but sometimes hydration can really affect us. Another thing is exercise, activity. Are you engaging in normal, healthy exercise and activity? It's recommended to do 30 minutes of moderate activity every day. And you know what? Most people are not doing that. Alcohol and drug use, so making sure that you're minimally using alcohol and drugs, and being responsible and intentional if you choose to engage in those types of activities or behavior. So be responsible with what you're doing and keep it to a minimum, and try to be as healthy and responsible with it as possible. As far as other things with self-care, what about your sex? Is it safest sex, the safer or safest sex that you can engage in? Are you getting regular checkups at your doctor or gynecologist? Having STI panels when possible? All of these things are related to self-care, because if you are taking care of yourself and you're the healthiest self that you can possibly be for you, you're going to be able to manage your mood better. Also, you can seek support. So through Pineapple Support, you can reach a sex-positive therapist. As I mentioned, sex positive is really important. When you are a sex worker and you go to a therapist, if that therapist is not sex positive, you're either going to maybe be met with some judgment, or you're going to be explaining definitions and terms that you might not want to sit and go over when you just want to talk about something else like grief or anxiety or these types of things. So look for somebody that markets themselves as a sex positive professional. Also feel free to interview therapists on the phone and ask them what their thoughts are about sex work, the sex work laws, or how sex workers seek help. So some of those questions might help you get some answers to find the most appropriate professional for you. There's also sex work groups, whether it's in person or there's some really great online groups that are available. Pineapple Support can connect you to some of those professionals, or I can as well. The resources aren't as plentiful as they could be, but they're definitely out there. So those support services are really good. Also, being active, having hobbies, doing things with friends, and being social is really important, and it's a really healthy part of your support system. The next thing for anxiety coping would be tolerance and acceptance. So a big part of anxiety is accepting, or anxiety coping is accepting that there is distress in your body, it's uncomfortable, and you can manage it and you can sit with it. So making friends with your anxiety, or making friends with the discomfort inside of you and understanding that it's there, noticing it, and allowing yourself to sit with it and maybe not take any big actions is a very important skill. Skills like this are typically taught through DBT, dialectical behavioral therapy. If you look up anything with DBT or Marshall Linehan, those skills could be very helpful. There's some wonderful workbooks out there for emotion regulation. Another thing to do is deep breathing. I know it sounds really easy. We'll take a few deep breaths. But as we breathe in and out, it really works with our nervous system to calm our body, especially on the exhale. So you might want to try taking a deep breath in for 4 seconds, holding it for 4 seconds, exhaling for 4 seconds. And it really actually makes a difference. There's technology-based support. There's some wonderful apps like Headspace that help regulate you, help your meditation. I actually really like this GIF or GIF. I don't know really the pronunciation of it, but there's one, if you look up a breathing GIF, you usually see a dot that will expand and contract to manage your breathing. So you look at the small animation that will help you focus as you're breathing. It's a really quick, easy thing you can just pull up on your phone. Aside from that, there's calming visualizations, meditation. A lot of research has been done on anxiety, PTSD, and yoga. In addition to breathing and other types of mindfulness. So there's all these wonderful ways that we can regulate our body to help our mind and help our regulation when it comes to anxiety. So we had all these tools that I talked about, what anxiety is, different types of anxiety, some ways that can affect your world as a sex worker, and some tools on just how to cope with it. If you need any more support or any more information, contact Pineapple Support. You can also find me, Dr. Amie Harwick, through my website. I'm on Instagram and Facebook under Dr. Amie Harwick. That's AMIE HARWICK. And I'd be happy to send resources as well. So signing off, and goodbye.